Hi friends, today one more interesting live. Uh, the speaker doesn't need any introduction actually. She's a very famous dermatologist in the city, Dr.Renita Rajan. She runs a center called Renda Skin and Hair. It is situated in Egmore. It's a beautiful center actually. People who haven't visited, probably it is definitely worth visiting the center. It's a beautiful one for the skin and hair. And our association is like long back. Like earlier I used to do the skin and hair consultation also. So that time we used to go for the conferences together. We went few conferences in Singapore and few of the conferences here, and few of her conferences. She organized few conferences in Chennai. I presented few topics in the conferences. So the skin and hair is very everybody will have the problem related to skin and hair. Like people will have a lot of hair fall related issues. A lot of people have the skin brightening related issues. When I used to treat the skin, I used to get middle of the night and all. I want to become fair. I want to lighten my skin. Do me a consultation. It's kind of people are so much obsessed with the skin lightening. In fact, so same way the hair also. Nobody is happy about that hair. Most of the people, they you ask anybody, the people, even I am not happy about my hair. I feel still my hair little baldness here. Nobody is happy about the hair. So a lot of doubts related to the hair, related to the skincare. Now if you see, a lot of products have come into the industry. We don't know whether it is really works well or not, whether it's safe or not. Lot of doubts related to the skin and hair care. So I thought, okay, why can't we call Dr. Renita? She is very knowledgeable and very we updated the knowledge so much, and and he treats a lot of patients. Very busy dermatologist. So actually, we have to thank Dr. Renita for joining with us in this live today. I expect her around 7. So I thought, okay, before that I prime our audience, and if you have any queries related to if you have any queries related to cosmetic dermatology, or even till she comes, I am ready to answer all your queries related to cosmetic surgery also. Since my surgical volume, Arun, thank you. Definitely we'll make sure that we'll give a very good talk, a very good session today. And once when I practicing cosmetic medicine, it's kind of a people come for a cosmetic surgery, they ask for a cosmetic medicine. That time we can't say that no, go there, go to the doctor and get the consultation. But when my cosmetic surgery volume picks up, obviously that time I can't handle both cosmetic medicine practice and the cosmetic surgery practice. So I kind of switched over to cosmetic surgery completely. And Dr. Renita is here. We'll
Hi, good evening. How are you?
I'm good, Renita. Till now I'm talking about you only. 7, 8 years back. Obviously, who will talk bad about you, because very knowledgeable person, down to earth, and I know how busy you are nowadays, and still you're educating the public through your social media platforms and various other ways. And
Thank you for all the kind words. We
I
go
already
back
interviewed
years,
you. I know
we go
that's
back years,
the
almost
Singapore
2013,
conference,
yeah,
the
2011,
Singapore
12.
Singapore
IMCAS.
Incas conference. Yeah, we met there, and after that, educating. That time, very few people go to the international conference at that time. I remember the dermatologist. After that, yes, nowadays a lot of people are going, and yeah, Renita, I introduced about you because before you come, I don't want to waste the time when you logged in. I told about your render clinic,
Rapid
beautiful
fire.
clinic in beautiful clinic in Egmore. Don't miss going there. I introduced everything about you. We go straight to the topic proper,
Question.
okay?
All right. All
See,
right.
because as I said, even I was talking to you in the phone in the afternoon. see, my knowledge about the skin is 5 years old. Like I stopped practicing skin and hair long back because my surgical volume picks up, and after that, I don't have time to do that. So we'll start with the skin brightening, Dr. Renita. Okay, because even now I get the inquiry in the middle of the night, sir, I want to lighten my skin. Like the 12:30 one another, I get a mail from the client. So I was wondering why so much is like into the skin brightening. Everybody wants to look fair. Like fairest of fat person also not happy about the skin color. They want to go one more skin tone higher. You know, so a lot of agents have come, like you have treated with a lot of the creams and chemical peel, all the glutathione injection, tablet, a lot of things have come. Okay, what do you feel which really works, and what is safer? Okay,
Yeah.
because everybody are doing different protocols. What is safer? Skin
Okay.
brightening and your ideas.
Okay. We will try to divide this into the skin brightening, uh, so-called lightening, and pigmentation treatment. For example, if you see somebody with a lot of say pigmentation post a condition, there are drug reactions which can actually overnight turn the person into somebody with heavy pigmentation. You will see a big difference. You will see people with hair color use side they'll develop a patch like this that goes down, and over a period of time you see them losing their color. They're two different shades totally. Those are all indications to go all out, because here there is a pigmentation issue that needs to be sorted. And one of the places where I found the use of glutathione very useful is lichen planus pigmentosus. Maybe or 5 years munadi, if you'd asked me, do you see glutathione as anything, I would have said not really. But the way it has helped us treat these conditions which are otherwise pretty difficult to treat, there are different grades. Seller, if they are early enough, all you need to do is handhold, and usually the pigmentation clears on its own. But sometimes you have to go all out to treat, and sometimes even that is not enough at that point. So when you differentiate this pigmentation group, yes, we can go all out because they need to be taken care of. Now coming to the brightening group, here you see at least majority, or at this point, majority of people probably do not ask for skin lightening the way they did 5 years ago. There's a lot of awareness. Munari, it will usually be the odd beauty parlor visit or the odd thing that they talk about self-care. But now there's enough material available online for people to see that whether what they're doing is the right thing. So there's number of people that talks about outright. I've had people who've come pointed to the ceiling and said, "Now in the color kupono, I want to be as white as a ceiling." You can't even begin to talk to or begin to take a plan with them, because they have no they probably don't have any realistic expectations. But in the last few years, at least I would say, like especially last 2-3 years, I'm seeing that there's a lot more comfort with the complexion. I've seen I am seeing a change. I do not know if it is true for the rest of the country, but number clientele is actually very comfortable in their skin, and the talk has gone towards healthy skin. எனக்கு அவ்வளோ ஒன்று வேணா healthy skin போ. So நீங்கள் அவ்வளோ ஒன்று வேணான்னு ஈஸியாக சொல்றீங்க, but to make it அவ்வளோ ஒன்று is actually a lot of work. Coming to the brightening group, the group that really wants the skin brightening, you can do it short term. You can consider giving a short term result, wedding ku munadi or event ku munadi, you can consider. But even then, our experience, our analysis has been that out of every 10 people that take or undertake a glutathione treatment for complexion or detanning and not pigmentation, we get all kinds of results literally across the spectrum depending upon the severity of the original condition. Like in planus severe, then we may get a very good remission, or sometimes we take years for remission. Now coming to just this group, which takes it mostly for detanning and stuff, out of every 10, 2 will give you glorious results. You will look at them, you'll ask them, please remove makeup எடுத்துட்டு, we want to compare the before after. That will be one group. 5 will have a good improvement in hydration. Baki 3 out of 10 will have nothing. That is why the whole craze of glutathione came and went. You must have seen at one point people were just buying glutathione on Alibaba and Amazon, and they were talking about this brand and that brand. Now you would have seen one slump. It's because you can't predict who will show results, because the oxidation reduction of the glutathione is very individual specific. And the same person may respond differently at different times. So for me, I'd say you can, with very, very limited use and maintenance, sometimes even as little as once in 3 months for people with melasma, still seems to work. But they probably are the 2 out of 10. And they give you that feel that it's grossly achievable. So everybody goes towards that, but it's very individual specific. I think more than the treatment, it's the response part of it, which we really do not have much data at this point. But in conditions which have pigmentary issues, I think right up there with cyclosporin and steroids for an immunological condition, I think this has very good potential, and we shouldn't throw out the baby with the bathwater. But there's a good improvement, but it is very, very individual specific.
Actually, even the same thing happens to me also. I tell the client, we are doing, see, whatever we read, whatever we have seen in our clients, we are putting that knowledge and treating you. Okay, but each body behaves differently to the treatment.
Exactly.
So
exactly.
That's the reason, like you end up in some of the mild complications, and the other person won't have any other issues. So it might happen to anybody. So understand this concept. You are not the machine. You are changing the part, and immediately it will work. Okay, it's not like that.
I wish it was math. I could say literally ellarkum ore result kudukka mudiyum. I really wish I could do that. I like laser hair removal for that, especially only underarm laser hair removal. You can do math in that. You will get reduction in 6 sessions. You'll be like finished and out. Not for the upper lip. The same laser, the same doctor, the same patient. Upper lip will behave like a completely different beast. Then you think about why is that? Yes, there is hormonal stimulation, so you can't get a permanent result. But how does it work for you in terms of procedures like lipo? Do you get completely different results across the board, or how does it work for you?
See, why I quit the non-surgical practice, in the sense, except the Botox and fillers, I quit almost all my non-surgical practice because difficult to answer the patient, because we are surgeons, we do surgeries, we see almost 90%, we can say, okay, this is going to happen. But non-surgical, no, it's very difficult to predict the results, like very difficult to handle the client because they are unhappy. It's very difficult to satisfy them sometimes, so that's the reason I don't want to, keep telling, I don't know, for you, no results, for them results, that's the reason I switched over to surgery. Surgery is almost predictable. 90% of the time predictable. 10%, yes, they might have a complication issues, but as a surgeon, we need to know how to handle it. If you don't know how to handle the complication, you are a bad surgeon. But some surgeons say that I never had a complication, he is lying. That's the only thing I can tell. That's also there. Yeah. And a lot of things are, like a lot of people asking, where is your clinic? Okay, the Renda Skin Clinic is situated in Egmore, or exactly that, just adjacent to the bridge, right, Dr. Renita?
The museum. Yeah. It's just opposite to the museum, and it's probably one of the ways, one of the nicest things I did inadvertently just before the pandemic, because the ventilation here is probably what is keeping us going. It's like a very nice and cross-ventilated space. So that's one of the reasons that literally saved us during the pandemic, given that we were working in different teams and stuff. How was the pandemic practice for you?
See, when that oxygen supply was in shortage, I stopped practicing because, like it's very bad when we use the oxygen. Yeah, that's the reason I stopped practicing. Otherwise, patients are willing to come. Patients are ready to come for surgeries, except our international patients the international patients have stopped coming. That's the only big drawback for us. Other than the local patients or the interstate patients, those people are coming. So other than that, it haven't affected, but I reduced my practice to half a day. That's a good thing happened in the pandemic. That's the only thing.
True. And we learned a lot more also, Lingla, from how I went more towards online, which I was pledging that I will never do online in my life, because I always like that conversation and communication. But surprise, online turned out to be a very good way to connect to very interesting people, and I'm actually grateful for. I was probably mind blocker in the. I did not want to do online, but that was a good learning for me. You have a.
But Anna, Renita, far is different. Okay, even earlier we do everything online because our international clients send the photos through WhatsApp and the email. You don't believe, one of my patients, a facelift patient, I keep exchanging almost 60 emails before he comes to India for the facelift surgery. Like we are so used to that online. Yeah. We're so used to the online practice. It's nothing new to us. So we survived.
For me, I learned a lot that I was against it. Because I find that like, there's a lot of work here. You meet them, you get to talk to them, you understand them. Because there's a lot of verbal communication that goes on. Suppose somebody says, I want to be as fair as a ceiling, I'm signing out of that. I'm not, you hear that unrealistic expectation, you just feel like better to avoid. And but I guess online has been amazing so far. It's been a very good.
Okay, we'll move on to the
Your
next
questions.
thing. Okay, glutathione is I understand that glutathione is very subjective, and how the injections, like how frequently you give injections, and what is the recommended dosage? We spoke about earlier also the recommended dosage. You said each person practices differently, but what is universally acceptable recommended dosage?
See, there are clinics that go up from 600 milligrams almost up to 6,000 milligrams. Some clinics even talk about 12,000 milligrams. It entirely depends upon the indication, and more importantly, there is absolutely no protocol for it at this point in time. Nangle, in the last few years, I would have changed the protocol 10 times depending upon which kind of results are more sustainable. So we keep changing quite a bit depending on. We have a yearly audit. We didn't do it in 2020, but we have a yearly audit. This 532 is from my 2019 data. So we actually sit down to check what is the subjective response, what is the objective response. So you can, I have had presentations that people talk about even up to 6,000 milligrams and stuff, but we generally stay somewhere in the middle between 600 and 6,000. Depends upon the indication. Protocols, you could even do for example, if you're thinking about Parkinson's, if you're thinking about conditions like neurological conditions, they even do once a day. Hepatological, they do once a day. So and they will be doing a very different dose as such. So tolerance levels, nariya data illa. This is all about IV. Oral, I used to use oral glutathione a lot few years back. Then there was this polypodium phase. Now polypodium turned, I've come on to pycnogenol, and again, because it's an in-house product, I have much more data on it. So I've kind of moved away from the oral glutathione alone to sun protective agents with lightening properties or brightening properties or pigment removing properties. So it's a little easier for me to manage at this point. But I definitely think another interesting molecule is N-acetylcysteine, vitamin C. All of these are available, but glutathione, other phase I think it was probably 3 to 5 years back. We still use it. We do not look at it like the treatment of anything. It is part of our protocol to treat specific conditions like PDL, which doesn't respond to anything else, LPP particularly. So those are the things that it's kind of moved on.
Okay. Any other chemical peeling agents introduced recent times, which is really promising for skin brightening? Like chemical peeling or any kind of like the topical application creams, which is really promising kind of.
Topically, at this point, peels and pathinganal, we are still with the old phenol peels. Phenol peels we use when you have a reasonable downtime. We still use it pretty much the same. I have gone back to salicylic because I find it more controllable. So, and also because of the DIY line, I'm a lot with salicylic right now. I do not like glycolic in general, but Pudicin, pathinganal, not a lot. See, again, the thing is, there's something called on trend, and there's something called the Indian skin. The on trend and the Indian skin don't always match. For example, simple example would be to look at the Botox units.
Okay.
If you treat the forehead like how you treat it for a heavy Caucasian face or for a wrinkled Caucasian face, it will sit down nicely like that. For us, we use very, very fine doses. Ilangla, it's like completely different. And for us, it's a lot more about the lower face, where the upper face, nobody really ages as much, even though we are in the sun. So our aging is quite different. Our protocols are quite different. Even in terms of the peel, the topical applications, the pigmentary agents, nariya perisa illa. I think, but yes, a lot of us have moved away from hydroquinone quite a bit for obvious reasons. But still, if you see out and about, triple combination still seems to be quite a bit. Compared to before, a lot of emphasis is on prevention. Munadi sunscreens. Now everybody accepts sunscreens. Clients and patients accept sunscreens much more. Most often they have exploded themselves already. So that's nice.
Correct. So the one more thing, usually why people are so obsessed with skin color is we are all ruled by the British. Okay, the British color is known to be like that. They are the boss. That kind of a thing. So the countries ruled by the British, they are all wanting to improve the skin color. You don't believe the Filipino ladies who earlier they used to have a big group of Filipino staying in Chennai. they used to come for the skin brightening, skin whitening treatment. They ask for the glutathione injections often. I was wondering, you are kind of fair. We can't think about fairer than this, like, but
No,
that is
but
that
Filipinos
attitude.
do a lot. To my
Really.
knowledge, they do a lot. They do a lot of skincare. Your laser protocols, நம்ம இப்போ when pico toning எல்லாம் we will tell once in a week, once in a month அந்த மாதிரி சொல்லுவோம். அங்கெல்லாம் once in 3 days, once in 3 days for 1 month sessions. You
Okay.
can't do that in this heat and in this weather. UV index like UV index 0 to 10 நம்ம 11 ல இருக்கும். So you can't really do that, but they do a lot more for skincare. You would have a lot of the 2 times I went to train at one very nice famous clinic, ID clinic in Salta. I went to conduct a training. I was a faculty for
Okay.
that, and I saw that the protocols themselves, we are just getting in there, and for us this seems to work because we naturally do not have as much upper face aging as the Westerners do, but their protocols are way ahead, and by the time somebody's hit 20, they have experienced fillers, Botox, or works. It's I find that we are way more conservative, and in a way it's nice. We're not generic yet. I do not know what the
I
next
like I
generation
like
will.
the statement that, see, the being conservative is something that's good in our as overall for the community. Like they all feel that look only is the matter thing. Like they don't believe that like their brain, their like how they carry, how they dress, all those things matters than like just a look. Like people come from the interior of Tamil Nadu asking for like all the I want to change my nose, I want to change my like everything. They don't lose. They don't have a confidence at all in their overall. The confidence won't come just by changing the facial appearance or like doing these creams. The confidence is something inside as well as outside. It's both the combination, only the confidence
Absolutely.
will come. Like,
Absolutely.
okay.
Because
Okay.
if you're going to fix yourself to a particular feature, if I fix my nose, then I will feel better. It's not going to work like that. If I fix this, if I fix my complexion, then I'm going to feel better. No, it's not going to. It's not going to work like that. That is where the whole concept of realistic expectations come in. When somebody comes and says, I want ABCD changes, but I understand how far I can go, and I'm pursuing it because I want to. For example, think about Botox like you're doing your eyebrow threading. You have a certain expectation. That's it. Your eyebrow threading is not going to change your life. You still have to do
Correct.
what you have to do to get where you have to get. That's it. Gives you a I personally do not like. I do not do threading because I'm kunjum. I find it a little uncomfortable. So that's it. I would happily give my forehead for Botox. Eyebrow threading I won't as easily. So I have to pep talk myself into going if it really gets terrible, or if I feel that I need to fix that. But the change it gives, it's an instant change. You're going to do
Correct.
a procedure, you're going to get a certain benefit out of it. That doesn't change your life. That doesn't change. At the same time, when people have painful acne and we fix it and they feel so much more better after that, definitely there's a huge boost. There is a value for how you see yourself, which comes from healthy skin or which comes from a particular feature you like. Somebody was talking to me and the minute I went in, I noticed a really nice looking face,
Nadu.
really nice looking nose. One of the, no, I'm just here, and all I hear is that I don't look good. So I was just thinking, didn't you see that you have a fantastic, it was how you do a non-surgical work and it comes out like a perfect nose. But that person wasn't able to see it. So there's this concept where it's called beauty leakage. It works positively and negatively. If you have a positive feature and you focus on that, the beauty leaks out from that. If you have a negative feature and you focus on that, literally everything else in the face looks negative. So you
Correct.
need to see where you want to leak what from.
Correct. Beautifully said. Beautifully said, Dr. Renita. The one more thing is, a lot of questions are coming related to scars, and a lot of acne
If you take
scars, and
some
a lot
of
of
them, yes,
treatments
yes,
have
yes.
come. Like a lot of audience are there for you, so a lot of people are asking a lot of questions because we can't answer each and every question. So I am trying to cover
Yeah.
everything.
Go ahead, go ahead.
Okay. So acne scars. Next, the commonest thing, like people ask is the acne scars. The problem is they want a clear looking skin like other people, and but they like they don't understand the reality most of the time. The fixing the reality, I know that you can tell us better. Fixing the reality is a very important thing before any treatment. What are the options available for the acne scars at this stage?
Okay.
I don't understand. There's a lot of the scar
Lot of, yeah.
differences are there. Yeah. Yeah.
One beautiful thing about acne scars is almost everything works. Even if you have a micro needling, like the regular basic mechanical derma roller works. Even if you have we used to have the RF needling, the one you use for cautery. I've done good work with that once upon a time. Literally everything works. Then you can of course talk about the fractional lasers, all the fractional lasers. Then you can talk about the fractional non-ablative lasers like Pico, or for that matter, can talk about the erbium YAG, erbium glass, CO2, all the lasers. Almost all of them work. Literally, even basic, maybe not for everybody, but the TCA cross alarm, it will work for some individuals. I used to use it a lot more, but now I find that it's much easier to do it and much more effective to do it with just the spot treatments. So I do not do the TCA cross as much as I used to do before. Then, of course, you have treatments like radio frequency, the range of radio frequency. You have microneedling RF, then you have the bulk heating RF, plasma RF, pixel RF. Then you have the newer jet volumetric remodeling. So basically, you have like a jet of fluid or hyaluronic acid that's placed into the skin through, not needleless, but you have a jet volumetric treatment. Then you have lifting treatments which contribute to reduce the acne scar induced sagging. So it's usually the premise is that everything works, not equally for everybody.
Correct.
Under session beautiful fillers, of course, fillers use panelam. Sometimes you have very tight scars, you can use a little bit of Botox to open it. Sometimes you have rolled scars, you can use inhalational steroids to open it up. But the response that you get will never be the same for some individuals. I've had people who've done amazingly well after 2 sessions. I've had people who haven't improved majorly after 15 sessions. It depends upon where we start out. So it's very, and this is the statement I begin with. I do not know if you're going to be my 2 or my 15, but at the end of 3 to 4 sessions, we will know which way we are headed, and then we can fine tune. So generally, Solvanga, 6 session, 6 session sittings, it doesn't work like that. You see it after each session, and then you change the plan if required. There is no package for acne scars. You cannot predict and say, take 6 sessions of PRP and you will get better. No, you cannot do stuff like that, because an acne scar, you go plan by plan. Sometimes a person can have a bad flare-up of acne post a session. Some people do react like that every single time. So you'll have to wait for that person to settle it down before you go to the next session. So in all ways, you try to, kind of customize it, even though there are these multiple treatments available. I like jet volumetric remodeling a lot. Energet and Solate. I really like the device a lot. It helps break down marginated scars, which were very etched marginated scars. I like microneedling RF a lot. Works beautifully for lifting, but won't touch marginated scars. So the same person has to undergo more than 1 session if they have both kind of scars. So now a slide which talks. I'll put in almost 23 modalities. I'll say everything and anything. So it entirely depends. You can use.
I totally understand. It's a individual things. All the things, it's not like works for everybody. We have to individualize the treatment, and as you said, every alternate dressings, we have to reassess the problems, and we have to switch over to other modalities. You beautifully said. Usually patients end up coming to us after finishing all your treatments. They expect 100% results. Then only their results are almost good. Almost you change the scars almost 70% better. After 70% become better, they wanting to come to us because all the non-surgical things are over. Then you do something. Usually, what we do, the fat grafting, the nano fat grafting, and most those kind of things, substitution and nano fat grafting. They expect us to completely make the skin, normal. As soon as, as you said, we have to make the expectation realistic first. Otherwise, difficult to manage. I said from here, your improvement going to be 20 to 30%. Okay, not more than that. You first understand it's never going to become a normal skin like Renita skin. Okay, so I always tell it never be okay, so I tell them it never become normal. So then if you want to try it, and they try it, and initially it looks very good because the swelling will be there, and it looks very good initially, but end results will be usually end of 2 months when you do nano fat transfer. And so this is about the acne scar. See, normal that the scars in the face, and like a lot of atrophic scars will be there. A lot of the hypertrophic scars will be there. What modalities at this stage? What is famous now, and what really works well in the atrophic as well as the hypertrophic scars?
Atrophic scars, any day I'll take atrophic scars, because hypertrophic scars are the ones that are difficult to treat. For example, if you have chin, they'll have papular scars. Nose, you'll have phymatis and papular scars. Those are pretty difficult to treat. Those are quite difficult to treat. Any day, and you can't put intralesional steroids into those kind of race scars, because there isn't the same principle as what happens in a hypertrophic scar. You basically use a lot of RF to flatten it. Hypertrophic scars, still I use a lot of bleomycin and intralesional steroid. Both work pretty well. They both work pretty complementarily. So sometimes you want a little softening, then you can use the intralesional steroid, and then you can finish off with an intralesional bleo. And sometimes you feel, I used to try cryo and all before, but I'm not very happy with the post-inflammatory depigmentation that happens.
So atrophic scars, what is that?
Sorry?
Yeah.
You were saying?
No, atrophic scars, what is the modality?
Atrophic scars, all the things I mentioned work.
Okay.
Because
atrophic scars, atrophic scars, most of the time, what I feel is give some volume underneath. So usually what I do is give some fat, filler. Or I prefer fat because it's easy for me. Yeah. So the fat will gives the kind of a good base for even future your any laser or whatever purpose planning to do for the atrophic scar. When you do the fat fill first, give the little more like that base to future work. அது பண்றப்ப they feel very comfortable. Some people after the fat transfer they don't come because they're happy about the results. So atrophic scars, I feel the fat transfer is still has a very big role.
Probably it entirely depends. Filler or even fat transfer, if you have a lot of marginated scars on the surface where it is nicely tethered, it goes between. So when you talk about subcision has come down a lot recently. I don't know if you noticed, subcision has come down a lot because we love the MRFs. We just feel that subcision used to give hematomas, used to give downtime, used to give a little bit of in some individuals it used to give persistent edema. All that has come down a lot because we do a lot of MRFs. Even to make it more selective, we use spot laser treatments, which don't even mess with the surrounding skin. When you do the full skin treatments, sometimes it can give you PIH. So now the thing is to break it up as much as possible, and definitely fat cells do stimulate further collagen production as well. So definitely it's worth considering. Absolutely.
Can you, as you said, we'll take some questions.
Take some questions. People want to know why my hair is flat and not frizzy. It is keratined. It is keratined, as I have said many times in my post. So yes, enjoy. I mean, I do not know if you get questions about the other aspects, but yes, for us, it's not just the dermatological part, but product use as well, because many things are. For example, this can affect hair fall. So there are a lot of surrounding aspects as well. Give break, please. Somebody wants a break.
Good. Final thing, we'll go back for the hair fall, because a lot of hair fall related questions have also came in this question session. I think we finish the hair fall and we'll take the thing. Okay. So the hair fall is, I remember when that PRP was initially introduced way back 6-7 years back. That time, each PRP cost around 35,000 or something. You remember that Harvest PRP, it's so expensive. I went for a course in Los Angeles one day and came back, started doing PRP, 35,000, 5 sittings. I can't answer the patient back because not much results, But nowadays I see a lot of youngsters post with the PRP and dermaroller. They're showing amazing results. What is your experience in the PRP and dermaroller? How you improvise the PRP and dermaroller nowadays, and how is the results and how long it stays?
Yeah. So now when you talk about hair fall, this is a common example I use at work. It is like filling a sink. Okay. You have to plug the outlet hole, and then only fill the sink. Otherwise, whatever you do comes out. PRP will stimulate the hair. It will fall off. If you put topicals, dermaroller, whatnot, it stimulates and then it falls off. You need anti-androgen support where it matters. And even in women, we see a lot of androgen-induced hair loss. And pasangalukku kekave vandam. That is the principal thing driving it. So if nothing is being done to plug the outlet, then you probably are just stimulating and overstimulating, and then that's about it. And at some level, you end up producing a scarring response instead of a stimulating response. Hair fall in men starts at 18, 17, 18 and goes on to 35. Do people really want to? And if you're taking the Korean protocol, it's PRP once in 3 days. French protocol once in a lifetime. US protocol once monthly. What do you want to do? And how long are you planning to do? Imagine the fellow getting poked once in every 3 days for a lifetime. What is it going to do? So it doesn't. And then people talk. I mean, even for that matter, if you've been treating derma roller treated scalps and then you try doing transplant, then it is so fibrous.
I know.
I like doing treatments for a short time because they are meant to stimulate the follicles which do not have as much vascularity, because similar to testosterone or androgen influence actually reduces the vessel size. So it causes a little bit of lower vascularity. So definitely for them, the whole stimulation part makes a difference. Why do we put agents like why do we put anagen promoters like caffeine, melatonin, or peptides? All of these are usually done primarily because you want to keep the existing hair in the growth phase and keep the vascularity happening. I introduced minoxidil very much later because I feel that it aggravates telogen effluvium, which can be seen a lot in early androgenetic alopecia. So if you look at all this, ultimately it's the medical management that is the base. Then you probably see all of these treatments helping. For us, I usually say 70% great results you get. And those are the ones that come to before and after on Instagram or wherever it is. The remaining 30%, 20% will do very well, quite okay, if you are persisting with them over a period of time. கொட்டாது வளராது அப்படியே இருக்க வைக்க முடியும், இல்லைன்னு சொன்னா கொஞ்சம் பெனிஃபிட் கொடுக்க முடியும், பட் அந்த ஃபர்ஸ்ட் 70 மாதிரி கவரேஜ் கொண்டு வர முடியாது. In the remaining 10%, நம்ம என்ன பண்ணாலும் genetics will laugh in our face and keep the hair falling. So that's basically how it is. So you decide.
இப்பெல்லாம் பேஷண்ட்ஸ் வந்து நம்ம கிட்ட ட்ரீட்மெண்ட் கேட்கறதுக்கு முன்னாடி they'll come and say PRP பண்ணுவீங்களா வரலாமா செஷனுக்கு அப்படிதான் கேக்குறாங்க. It has to change. Give the doctor to decide what treatment is ideal for you, and அதோடைய pros and cons எல்லாம் கேட்டுட்டு you come, because you read something online. நான் ஆன்லைன்ல படிக்கிறதுக்கும் நீங்க ஆன்லைன்ல படிக்கிறதுக்கும் வித்தியாசம் இருக்கு. How you perceive that particular fact is different, so அதனால வந்து டாக்டர்ஸ்ட விட்டுருங்க. பிகாஸ் நீங்க என்னதான் நீங்க ஆன்லைன்ல படிச்சாலும் நீங்க டெர்மட்டாலஜிஸ்ட் ஆக முடியாது, அவங்க நாலேஜ் உங்களுக்கு வராது. ஸோ அதனால வந்து யூ கோ டு த டாக்டர் அண்ட் மேக் ஷூர் தட் அவங்க சொல்றதை கேட்டு பழகுங்க. டெர்மட்டாலஜி பிளாஸ்டிக் சர்ஜன் லைக். ஸோ அதனால வந்து பெட்டர் நாட் டு do the self medications or self treatment, or like go to the doctor and ask the doctor for particular treatment. It does not work. As Dr.Renita said, the medical management is like the first line management, the hair fall, then only all these things will come. So அதே மாதிரி என்ன பண்ணுவாங்க, கம்ப்ளீட்டா பால்ட் ஏரியால பிஆர்பிக்கு கேட்பாங்க, டெர்மா ரோலர் கேட்பாங்க. they don't understand that completely bald area only villous hair will come, that ஒழுங்கா hair transplant பண்ணனும், அந்த மாதிரி கான்செப்ட்லாம் they don't
even realize. Transplant பண்ணும்போது sometimes you may not have enough donor area. அப்படி கேட்கும்போது பாடி ஹேரும் இருக்காது, எந்த ஹேரும் இருக்காது. then you think that எப்படி இதை சொல்ல முடியும், ஆனா there will be somebody who will actually do a transplant on that, and then they will have one fringe in the front. Sometimes I just do not understand in that communication misadana. I won't understand, but yeah, I always feel, if I feel that somebody is not listening to me, or I'm not able to communicate, or there's no connect, it's best to disconnect. As simple as that. Probably and ஒரு mutual respect, நீங்க சொல்றீங்க இல்லையா, ஒரு ட்ரஸ்ட் இருக்கணும், ஒரு mutual trust. If that is not happening, then it's best to gently disconnect, is my thought.
அதுதான் the vibes has to match. Doctor and patient vibes has to match.
And it's both ways, right? And it's both ways. Sometimes it's usually like even I need to feel that this person is going to be, they're going to take the treatment in the right way, reciprocate, and all of those things. So that's very, very important. It is never one way. I had somebody who actually said that insulin resistance, lots of thickening of pigmentation, neck pigmentation, hyperpigmentation, acne, hirsutism, literally everything that was hormonal was hormonal. And then they come in and say, I'm not willing to lose my weight, I'm not willing to work on my diet, I'm not going to do anything. Then I ask them, how do you then plan to fix all this? I'm already here. No, you fix it. It's a cannot. It's the other way around. I cannot.
Other way.
I would love to do that magic wand thing and make it all okay, but I cannot. It is completely two ways.
Correct. See, one more thing. See, the lot of like lot of times, we all become successful because we understand real emotions behind this problem. I read one of your the post about the lip filler. Okay, how insecure we
Okay.
become. Like the same thing happened to me also. So when I was a kid, around 13, 14 years, I have a gynecomastia issue, the male breast issue. Okay, so I know that how much psychologically it upset you in each and every level. So when the patient comes to me, like when we talk to the patient, we understand their emotion. That's what really, like makes the patient happy, and like we respect their issues, and like we are willing to treat. I feel that when we undergo the same issue, sometimes back it's easy to understand the problem.
And true,
Same way
true, true.
that how that body image issues you're handling, Dr. Renita. Because I 100% I'm sure that out of 10 patients, at least one patient have mild body image issues. Okay, how are you handling? How frequently you send it to a psychiatrist? How you convince them to
Go to a
psychiatric
psychiatrist.
counseling?
So time it works, so sometimes it doesn't really work out. I'm not able to. At times, I won't be. Even this week, I had somebody that was on just plain Betnamate cream every day for skin fairness, and wouldn't stop it. It's almost like just plain Betnamate cream. To my knowledge, more towards the, as you go towards the northeast, it's very common, this on getting it from the pharmacist and using it. So how much ever we counsel, the thing is like, when can I start this again? When can I go back to this? I said, you'll have to come out of that cream, and only then I can actually work on your skin. You'll have to give me that space, because whatever you do when the skin is withdrawing from a steroid, it will flare. Whatever you do when the skin is withdrawing from a hydroquinone phase, it will flare. So I'm repeatedly talking about, yes, let's come out of this. After about or 10 times that you speak about it, then the person said, no, I want to do this. I said, you get second opinion. This is all I can do. I don't think I have the knowledge to treat advanced cases like this. So you please get a second opinion. That's it. That's
Dr.
about it.
Renita, I can relate so much here. நிறைய விஷயங்கள் நீங்க பேச தெரியும் எனக்கு. லைஃப் ஃபைனலா 10 தடவை எக்ஸ்பிளைன் பண்ணதுக்கு அப்புறம் டாக்டர் எப்ப சர்ஜரி பண்ணலாம் டாக்டர்? I think surgery is a better option பாங்க. So why should I wasted?
எக்ஸாக்ட்லி. நீங்க அப்பதான் அந்த வார்த்தையை சொல்லி முடிச்சிருப்பீங்க. உங்களுக்கு வந்து எம்ஆர்எஃப் வேண்டாங்க, உங்களுக்கு CO2 பண்ணிருக்கு, இல்ல உங்களுக்கு CO2 வேணாங்க, உங்களுக்கு எம்ஆர்எஃப் பண்ணிருக்கு, நான் எப்ப அடுத்தது பண்ணலாம்? Okay. I disengaged. Earlier, I used to take it on myself, thinking that, is it something that I am not communicating? Is it something that naan tavara pandrena? Is it something that I am not able to? But day one, I tell them, especially இப்போ ஊர்ல இருந்தெல்லாம் வரும்போது, day one, I tell them, do you really want to continue here? Even I had somebody flying from Hyderabad this morning. I feel bad. Do you really want to continue with me? Because I would not go to another city to do a recurrent, something that needs repeated follow-up. Yeah. So I would probably tell them that you should not be, you should be in a hair follicle, you should be in a peaceful place. Ninga masa alanjali padi mudi kotti pogu. So I am not somebody that actually goes out to do something like that. So I said, I'll be happy to refer you to somebody if I know somebody in your locality. That's usually for any out of station patient. That's the first thing I say. Now I'll think, நம்ம எதுவும் சொல்ல மிஸ் பண்ணிட்டோமா? இப்பெல்லாம் I just think, I can't please everybody. In my own way, I'll keep going. Have you come to that stage where you just say, whatever I do, there'll be some people who understand and some people who don't? That's it. What do you say?
எங்களுக்கு ரொம்ப சீரியஸ் ஆக்சுவலா. இந்த எங்களுக்கு வர இஷ்யூஸ்லாம் very very serious. They'll be so depressed. Their eyes will be very sad. They, they come with
equally bad. I think sometimes.
Okay, one important question is: Betnamate bad to use for face skin daily? As I too use it, you have to answer for this because
charming resort, whoever you are, even if at the end of this life, this is the only good that has come out of it. I think this is a very important and relevant thing. Kindly do not use steroid creams like Betnamate on the face for any period of time. Your dermatologist, if they have given it, they probably would have given it for a week, 2 weeks. Non-steroid use பண்ணும்போது, I usually write 1 week or 2 weeks and stop in a போட்டு கொடுப்போம். We always give that stop at the end of the whole thing. So please make sure that you're not using this, especially if you're going to be using it repeatedly. It will give you sensitivity, acne, facial hair growth. It will give you increased skin vessel visibility, which means skin thinning, the vessel starts showing up, and also it will give you facial stretch marks. I have not seen facial stretch marks in anything other than topical steroid use. So that's something
Very
that
difficult
needs
to treat also.
if you cannot do, I mean, but I've seen people come like a tiger with stretch marks all over the body. Inner thigh darkness and solely steroid photo. Now it will become like literally like one tiger. Underarm darkness, steroids photo. So please do not use steroids in these areas where the absorption is so much more. So the take home, I think with Dr. Karthik's permission, if the take home of this live is only that you do not use topical steroids for any period of time on your own, I'll be, this is much, it's a very big success for this live, actually speaking.
Correct. Thank you, Dr. Renita. We had a wonderful session, and we hope to see you so often in our lives. And I know that you are busy. We'll educate the people as much as possible. And thank you so much for you agreed to come with us. Thank you so much.
Always a pleasure to work with you. Thank you so much. Take care. Bye.
Thank you. Bye.